as we launch our campaign, it's not our voices that matter, it's the voices of those who are at the front line of the struggle to cut down maternal mortality in Sierra Leone.
Adama started bleeding. She went to the midwife, where she went to deliver. She delivered the baby and started bleeding. So as the condition went worse, they decided to take her to the hospital, the Maristop Hospital. They bought a taxi. As soon as they reached the hospital, she died. So they didn't even take her out of the taxi. They just returned with the taxi to the mortuary.
Women's rights activist Issa Cole has been campaigning to improve maternity facilities and to highlight the shocking figures of maternal death in Sierra Leone.
I think she was feared of not having money. She was feared because of the bills, because they already told her she's going through an operation. She didn't have the money and she didn't know where she's going to. If she borrowed the money, where she will get the money back to pay the person.
Maternity services in Sierra Leone are supposed to be free, but this is rarely the case. Health services are severely underfunded, under-resourced and understaffed. In a country where 50% of the population live on less than $1 a day, the poorer you are, the more likely you are to die in childbirth.
All over Sierra Leone is a very big problem. They're having so many different types of problems. You're having lack of medicines in the hospital. There are health centers, but there are no nurses there. Lack of trained nurses, lack of qualified doctors, no medicines there. No transportation. Maybe the health center will be here, then you have to walk 2 or 3 miles before reaching to the health center. That's a very big problem. And no vehicle facility, no ambulance. In the health center there you don't have ambulance. The nurses have their own families to take care of. The doctors also have their own families to take care of. At times they will be working for about 3 months without no pay. Most women don't know their rights. They don't know their rights, that they have the right to good health. To have safe water, shelter. They have the right to live. The human rights has to come in at some places, as well as the government need to come in also. We ourselves, the women, need to advocate for ourselves that we are suffering. We are dying because of lack of knowledge. We are dying because we are poor. We are dying because it looks as if there is no one that is hearing our stories.